Hi my lovelies, welcome back to my channel. If you're new here, my name is Anna. I'm a doctorally prepared women's health nurse practitioner, and this channel is where medicine meets a lifestyle. We do some girl chats, I go over women's health topics, and I also give a behind the scenes look at me building a life that actually feels as good as it looks. So welcome, and I'm glad you are here. Be introducing a new series today that I call The Tea, where I just go over some women's health topics that I talk to my patients about basically every day. So today's The Tea episode is birth control. So the tea on birth control. I'm gonna go over how it works, how most of the methods, birth control methods, how they work, some pros, some cons, and maybe who I would recommend this for. And I hope that helps. I want to preface the video or getting into the tea with saying that there is no perfect birth control method, right? So what works for me isn't going to work for you. It works for your auntie isn't going to work for you. Your birth control method that you choose should work best for your lifestyle, your goals, your actual health conditions, and what works best for you. No one else matters when you're making this decision, only you. So let's get into it. I'm gonna separate it into hormonal methods and non-hormonal methods. Start with non-hormonal methods. We have condoms. There's lambskin condoms, there's latex condoms. If a lot of people use lambskin if you're allergic to latex. However, keep in mind that lambskin condoms do not protect you against STIs. Latex condoms protect you against STIs and STDs. That is the only birth control method that protects you against sexually transmitted infections. The only one, okay? Pro to condoms is they're fairly cheap depending on the brand. You can buy a box, you have multiple, right? And you can carry them. I always recommend my patients to carry, if they're choosing condoms, to carry your own condoms so you feel empowered and protected and like your care is in your hands rather than depending on your partner to provide the condom, okay? So a pro to this is that they're cheap, they protect you against STIs and STDs. Con, human error. Shit happens. A condom can slip. Imperfect use, they can break. It relies on the person to keep it on. So a lot of women that do use condoms, they prefer a backup birth control method for extra safety. Next, another non-hormonal birth control method is Phexxi. Phexxi is a pre-filled applicator. You insert it inside your vagina for 1 hour prior to sex, and it's a pH modulator. It is not a spermicide because it doesn't contain the naloxone 9, which is a spermicide. So Phexxi is literally lactic acid, citric acid, and potassium bitartrate. And so you can get that prescribed from your provider. It should be covered by insurance. It's not as popular, it's 86% effective. So not as effective as the other birth control methods. I believe it's about 96% effective with perfect use, but who's perfect? I really wouldn't recommend this for sex workers because once you insert it, you have 1 hour. Sometimes with sex workers, you can't really control the time. So I really wouldn't recommend this for sex workers. Also with Phexxi, I would recommend an additional birth control method. And I hope that helps. Bye. The copper IUDs. IUD stands for intrauterine device, okay? And that's literally wrapped in copper. And how this works, it makes the uterus inhospitable to implantation, right? So a pro to this particular birth control method is that it lasts a long time. It lasts for 10 years. Some research shows that it's good for 12 years, but it lasts for at least 10 years, which is amazing for some women. And Some women prefer non-hormonal for maybe religious reasons or cultural reasons why they can't use a hormonal birth control. So it's good for that, and it lasts a long time. A con to the copper IUD: it can make your periods heavier, longer, and more painful. And so I wouldn't recommend this method for women that already have heavy, long, painful periods. So for example, if you're already a person that has heavy periods, right, and we're already soaking through pads and tampons and our period is already 7 days, I'm not going to suggest that you get a copper IUD. And again, this is just education. This is not medical advice. Go and see your lady to know which method works best for you. For a combined, so first we'll go over birth control pills. We have combined birth control pills, and then we have progesterone only pills, POPs. Combined pills is estrogen and progesterone, right? How that works is by suppressing ovulation, no egg release, no pregnancy, right? And it also thickens the cervical mucus. Some pros to this method is that it helps with PMS, PMDD symptoms, very good cycle control, and it's easy to titrate. Pills in general are easy to start, easy to stop, and it can help with acne. It's my dog. It can help with acne. Some cons to this is that a lot of women have issues with maybe the nausea associated with taking the pill at first, and some weight gain, and this is usually water weight. But I always tell women with any hormonal birth control, you can have increased appetite. Now it's important to look at our diet and see if we have a healthy diet, do we have an exercise routine, and things of that nature to kind of combat this potential weight gain. Also, a major side effect of this that people really kind of complain about is breast tenderness. You have to take it at the same time every day. Now, if you're a woman that, is kind of forgetful, doesn't really know what their schedule is like, I wouldn't really recommend this method for you. This is good for the routine girlies, or if you already are taking pills at a certain time every day, then you can just add this one in. Again, it's easy to start and stop. Some women absolutely cannot take any birth control that has estrogen in it. Those women include if you have migraines with aura, and aura is visual changes, like we're seeing black boxes, ghost circles falling from the sky, things of that nature. You cannot have birth control with estrogen in it. Okay, women with uncontrolled hypertension, if you are over 35 and you smoke at least 15 cigarettes a day, you are also high risk, and I wouldn't recommend any birth control with estrogen in it because of the cardiovascular risk associated with the estrogen. Now, of course, you want to go and see your lady to go over your risk. Next, we have progesterone only pills, and that is your mini pill. It's literally progesterone only. The pros of this is that it's a pill. You can start it, you can stop it. I have a few more cons with this one. Less cycle control, more cycle unpredictability. Like, you can spot in between your cycle, you can spot for a couple days with the progesterone only pill. Also, it's a little bit more finicky with the timing, so you have to be more on time with this pill, so we shouldn't be off by an hour. Now again, if you find yourself missing a pill every day, every other day, a couple times a week, this is not the best birth control method for you, because once you're missing the pill, it is not effective. If you do not take it every day, it is not effective. There we go. Next, we have the patch. The patch is estrogen and progesterone, same like the combined pill. Pros to this, it's more so like one of the closest things to like a set it and forget it method. You change your patch once a week. Con, it may cause some skin discoloration, and it may not be as effective at heavier weights. Next, we have the vaginal rings. It's estrogen and progesterone as well. Same as the patch, same as the combined pill. It's absorbed through your vaginal mucosa. A pro to this, it's hidden. You can set it and forget it. So the ring, you leave in for 3 weeks. You take out the last week, and that's when you have a withdrawal bleed. This method has estrogen in it. Again, this is not safe for people that have migraines with aura or have significant cardiovascular history. A con to the ring is that you can have increased vaginal discharge. That is a common side effect of the ring. Not a lot of people come in complaining about it, but it happens. Also, some women aren't comfortable with taking their own ring in and out their vagina, and sometimes they can put more than one ring in the vagina, which you should never do. If you're unsure, always go back to your person and have them remove the ring. Don't insert more than one ring at a time. But this is one of my favorite birth control methods. For some people, you leave it in for 3 weeks, you take it out the last week, is perfect. For me. Next, we have the shot. That's the Depo-Provera shot. You get 1 intramuscular shot every 3 months. Now, how this works is progesterone only, so good for people that cannot have estrogen containing birth control. Pro to this, it lasts for a good amount of time. A set it and forget it method. You don't have to think about taking something every day. Con, with the Depo shot, you can have some irregular bleeding, some spotting. Same with how I discussed with the mini pill. So you can have some spotting. Provera Depo shot, you only take it 4 times a year, and that is very effective. For some women, their periods do stop with the Depo shot, and they enjoy that. A con, a lot of women do complain or have some concerns about weight gain on the Depo shot. I'm not gonna lie, if you are concerned about weight gain, I would not start on the Depo. Some progesterone only methods, such as the Depo, such as the Nexplanon, it can make anxiety and depression worse. So if you have a history of anxiety and depression that is untreated, unmedicated, you're not seeing anyone, progesterone only methods can make this worse. With the Depo though, once it's injected, you cannot remove it from your body. That is another con about the Depo. But pro, once it's in there, it's in there. Also, delayed return to fertility with the Depo injection, because so next we have the implant. That's the Nexplanon. It's a small rod-shaped device. It goes on the inside of the arm. This is progesterone only. Pro to this, it is one of the most effective birth control methods out there. It's over 99% effective. It's good for 3 to 5 years. It depends on your provider. I say 5 years, but it's good for at least 3 years. On to this, some women do have complaints about acne because it is progesterone only. Some women do develop some acne on this, and mood swings. Again, if you have a history of anxiety, depression, this can make it worse if you're untreated. Okay, but if you're treated, then hopefully you're okay. Again, talk to your healthcare provider about your history and your concerns to see if this really is the best fit for you. Another con with this is the bleeding pattern is kind of unpredictable. So a lot of women can spot on this birth control method for an unknown amount of time, your body up to 6 months to kind of know what it's gonna do. And some people can have their periods go away altogether, or you can have really regular periods. So give your body up to 6 months to kind of know which way it's gonna go. This does require removal and reinsertion. So how it's inserted is a small amount of lidocaine, like same if you were to get like dental work done in your mouth, like a cavity filled or something like that. The lidocaine under your skin, and it's literally inserted right under your skin. You can feel it if you want to, but no one can look from the outside and say like, oh yeah, she has a Nexplanon in her arm. So it's super discreet. This is why I like this method. Who's gonna know? How are they gonna know? Tool is the same. Lidocaine, small scalpel, push it out, removed, done. Next, let's talk about hormonal IUDs. So our hormonal IUDs, there's a few. We have Skyla, which is the little sister, Kylina, which is the middle sister, and Liletta and Mirena, which is the big sister. And so Skyla has the least amount of hormones. Liletta and Mirena have the most amount of hormones at 52 milligrams. And this is also progesterone only method. So a small amount of progesterone is released mostly in the uterus every day. Now, the good thing about the IUDs is that they can last from 3 to 8 years. Your Skyla lasts for 3 years, your Mirena and Loletta lasts for 8 years, and that's wonderful. Now, I always tell my patients, some women, you can have either really light periods, really regular periods, or no periods at all. Most people have their periods go away altogether when they stay on this hormonal method. The insertion process is not fun. It's not fun. And anyone that tells you that, oh, it's nothing, they're lying. It's not fun, okay? Because we're going through your cervix. So IUD, intrauterine device. We are going through your cervix into your uterus, right? And so by going through your cervix, we're dilating it. You're gonna feel cramping. It'll feel like a strong cramp. If you feel anything, it'll feel like a strong cramp. Of course, you have options for pain management. They have ibuprofen. We use Cytotec to get the cervix nice and ripe and soft for the insertion process. Some clinics use Cytotec, some don't. You have ibuprofen, you have a lidocaine that they can use. Just talk to your provider. IUD, you can also experience some cramping and spotting for the first couple months, and like the Nexplanon, I tell women, give your body up to 6 months to kind of know what it's gonna do. You can have either really light periods, really regular periods, or no periods at all. And again, on this method, people tend to have no periods at all, which is a plus for some women. Birth control does not just affect your uterus. It talks to your ovaries, it talks to your brain, it talks to your skin, it talks to your gut. It literally talks to every single part of your body. So again, what works for me isn't gonna work for you, because every body is literally different, okay? And I want you to take this in and remember that you have options. There's so many options. Talk to your provider. Make sure you have a relationship with your provider where you can be honest about your concerns, and they'll take the time to go through your options and what's probably the best fit for you. You may find your perfect birth control method, or all of them may come with a little something. You just have to find the one that has the something that is good for you. So when I do my birth control consults, I like to look at the person's lifestyle. Like if you're a super busy person, I'm not going to recommend a pill for you because you're busy, you got shit to do, you're not going to remember to take a pill every day. I would recommend a long-term, a LARC, which is a long-acting reversible contraceptive. Basically a Nexplanon or IUD, or maybe a Depo, or maybe a NuvaRing if you don't want to make that commitment to a long-term method. Okay. I also look at your period patterns, your menstrual health. I look at your mental health. Do we have anxiety, depression? That is a big one for me. I also look at medications that you're already taking. I look at your family history. We talk about future fertility goals. For example, if you come to me and you're like, hey Anna, I want to have a baby in the next year, I just don't want to have one right now, I'm probably not going to put you on Depo. I'm going to put you on maybe a birth control method that I can easily discontinue, or we can easily discontinue. So that's why it's important to really go over and discuss your goals with your provider. If you say, hey Anna, I'm struggling with acne, if you're struggling with acne, I might start you on something that has estrogen in it if it's safe for you to take. Again, if you have migraines with or a significant cardiovascular history, I wouldn't recommend anything with estrogen in it, because estrogen makes the blood more viscous anyway, child. Lastly, birth control isn't only used to protect you against pregnancy, it's used for a plethora of things. First of all, it helps with acne, it helps with androgen, it helps with a plethora of things. Like if you have terrible periods, it helps with that. It helps with formation of ovarian cysts. If you're someone that constantly have ovarian cyst rupture, you also want to look into that, but it helps with that as well. If you're a person with acne, birth control can help with acne. if you have PCOS and you need to regulate your cycles, because we need to keep that lining of the uterus nice and thin and cycles regulated. Control also helps with that. So it's not, I like to call it hormonal method, but you know, birth control is the most commonly used term, but it helps with so many other things. It's not a definitive marker of womanhood, so that's also not a thing. That's also not a thing either. Like, who cares? Do what works best. At the end of the day gotta end. Do what works best for you. If you have any comments or questions, leave them down below. If you found this video helpful, leave me a T emoji, and that lets me know that you found the video helpful and I should keep these videos coming. If you have any topics that you would also like me to go over, leave them down below. And thanks for staying all the way to the end. Like, comment, subscribe, and I'll see you soon. Go see that lady. Go.